Julie joins us, and you've had a few of these treatments just in the last week, right?
2. Right.
What was your experience like? How are you feeling following that treatment?
After my first treatment, I woke up the next morning and I had less heaviness in my throat and my chest. The heaviness that you feel on an ongoing basis zaps your energy. And I have way too much to do to be sucked down in that all the time.
So is it fair to say in the short term, you've had a very pleasant experience with the use of this infusion?
Right.
This is something very new, and we're joined now by the founder of Ketamine Clinics, Los Angeles, Dr. Stephen Mandel. You've been using this treatment now for a while, obviously. So in your experience, the treatment has been really effective for some suffering with depression.
Yes, that's correct. Actually, it's been effective for about 83% of my depressed patients. And we've treated over 200 patients.
And
Dr. Mandel, speak a little. Your specialty is anesthesiology, correct?
Yes, that's right.
And ketamine is typically a drug that anesthesiologists are familiar with. To treat a problem in another specialty, talk a little bit about how you came about in doing that and what you would say to the opponents or critics who would say, you should stay in your lane, you should stay in your specialty. What would you say? Well,
healing and compassion and dealing with suffering is my lane, and it's a lane we share with every other physician.
But it's not an FDA-approved treatment for depression, but that means it's used off-label, which is fine because a lot of things we do in medicine are off-label. So people listening, what should they ask about the pros and cons to this type of treatment for depression, in your opinion?
Well, they should ask what the alternatives are. They should ask what the risks are with this. And they should ask what the benefits are going to be and how much it's going to cost and how long it's going to last.
So you just asked the questions.
Right.
How would you respond to your own questions?
In Ketamine Clinics of Los Angeles, we treat treatment-resistant depression, meaning not that the patients are resistant, meaning the treatments haven't worked. These are people who are hurting, who are really kind of at the end of the line often when they come to us.
You're their last hope for a lot of these folks.
For many of them, yes.
And so how many, when you take someone like Julie who's now had 2, we'll call them acute treatments, how often, how long does treatment last, and what does it cost for someone like Julie?
The 2 treatments are $1,500, $750 each. They have to be 2 days apart. If people benefit, then I recommend 4 more infusions. The reason for that is the early work in ketamine showed great response, but it lasted a very short time. We're doing 6 infusions over 2 weeks, and we're getting many months. Our average is 3 months. We have people who I did 2 years ago, who I'm following, whose depression scores are still low, who are still going to work, who still don't feel, as Julie so eloquently puts it, heavy.